This is the General Biology for Hematology podcast. The topic overview is as follows. We'll start off with blood, and then plasma, cellular elements, blood clotting, and then cardiovascular disease. So let's go ahead and start with the first topic, which is blood. If you take blood and you spin it down in a centrifuge, you'll pellet the cellular component, which composes approximately 45% of the volume of blood. And then the remainder is what we call plasma. So let's start off by taking a deeper dive into plasma. Plasma contains a lot of different proteins and a lot of different things that give it functional purpose. The first is plasma proteins, like albumin. Albumin has two primary functions. One is to buffer against pH changes in the blood, and the second is to provide osmotic balance between the blood and the interstitial fluid. How does it do that? Because the albumin is large enough that it doesn't leave the capillary, it essentially acts as a solute that draws water in, and this opposes the hydrostatic force that just drives fluid out of the capillary. The second component is antibodies. You'll find these in the plasma. They combat viruses and other pathogens. Third is apolipoproteins, so lipids. They are hydrophobic, and they would otherwise be insoluble in water. But when a lipid binds to an apolipoprotein, it can travel through the blood. Fourth is fibrinogen. This is a clotting factor in its inactive form. And when blood vessels are injured, it gets converted into its active form, where called fibrin, and it can help form blood clots. Lastly, you have the term serum, and this refers to blood plasma from which the clotting factors have been removed. So in a research setting, you should know the difference between these terms because you'll come across it. So you have your blood, and then you have plasma, which excludes all of the cellular components, and then you have serum, which further excludes all the clotting components present in the blood. In addition to, the plasma proteins, the antibodies, the apolipoproteins, fibrinogen, you also have other substances in transit in the plasma, like nutrients, metabolic wastes, respiratory gases, and hormones. Okay, the next topic, cellular elements in the blood. So there are two classes of cells in the blood. You have your red blood cells called erythrocytes, which transport oxygen, and then you have your white blood cells, which function in defense. So erythrocytes, they lack mitochondria, and they generate ATP exclusively through anaerobic metabolism. And think about it. Oxygen transport would be less efficient if the erythrocytes were aerobic and consuming some of the oxygen that they carry. Each red blood cell contains 250 million molecules of hemoglobin, and each hemoglobin molecule carries 4 molecules of O2. So you can do the math. That means each red blood cell carries about 1 billion molecules of oxygen. The lifespan of an erythrocyte is approximately 120 days. And if your oxygen levels fall, your kidneys synthesize and secrete a hormone called erythropoietin, EPO, and that stimulates the generation of more red blood cells. That's the first, erythrocytes. The second is leukocytes. They defend your body. There are two lineages. You have the lymphoid progenitor that gives rise to T cells, B cells, and NK cells. Then you have the myeloid progenitor that gives rise to the neutrophils, eosinophils, basophils, monocytes, and erythrocytes. When it comes to the myeloid progenitor and what it gives rise to, I'll give you one sentence summaries of their function. So you have neutrophils. Those are, white blood cells that function as first responders to infection, and they'll engulf and destroy bacteria and other pathogens. Then you have eosinophils, which combat multicellular parasites, and they're involved in allergic reactions by releasing enzymes. And then you have basophils, which release histamine and other chemicals or proteins during allergic reactions. And then lastly, you have monocytes that are white blood cells that will differentiate into macrophages or dendritic cells, both of which aid in the adaptive immune response by engulfing pathogens and presenting antigens or proteins to T cells. And then from the lymphoid progenitor, you obviously have T cells, which can be cytolytic, and you have B cells, which can become plasma cells that secrete antibodies. And NK cells, they're known as killer cells because they have cytolytic functions. The stem cells that produce the cellular elements of the blood are located in the bone marrow, primarily in the bones of your ribs, vertebrae, sternum, and pelvis. The next topic is blood clotting. So immediate and primary blood clotting is achieved with a platelet plug. Secondary blood clotting is achieved with a fibrin clot. So let's discuss the first. So clotting gets initiated when the blood vessel's endothelium, that innermost layer, gets damaged. And when the outermost layer, like the connective tissue, gets exposed to the blood components. So what happens is the platelets, they'll adhere to the collagen fibers of the damaged vessel wall. And these platelets, they also have glycoproteins on their plasma membrane that make them sticky. And this leads to platelet aggregation and subsequent formation of the platelet plug. Now, after this, the platelets will also secrete clotting factors, as do the damaged cells of the vessel wall. And those clotting factors will mix with clotting factors present in the plasma. And this results in a signal transduction pathway that converts a plasma protein called prothrombin into thrombin, which is the active form. And thrombin then converts fibrinogen into fibrin. And it's the threads of fibrin that weave together and trap erythrocytes and form the fibrin clot. And this is what we typically refer to as a scab, which is just a blood clot on the surface of your skin. And it's composed of platelets, red blood cells, plasma, fibrin, and white blood cells. The last topic is cardiovascular disease. So atherosclerosis is the hardening of arteries by accumulation of fatty deposits. So one etiology model as to how this occurs is that atherosclerosis is an immune-mediated process. So when there is damage to the vessel wall, this triggers an inflammatory response that attracts leukocytes, which then take up lipids like cholesterol and start forming a plaque. So plaque formation will result in stenosis, which is the narrowing of the blood vessel. And this can result in ischemia, which is the inadequate delivery of blood to an organ. Stenosis of a coronary artery in the heart can result in angina, which is chest pain, and complete occlusion of a coronary artery can result in myocardial infarction, which is a heart attack. And when you have a myocardial infarction, that's when cardiac muscle tissues die because of loss of blood flow. Loss of blood delivery can also occur in the brain, either due to an occluded or ruptured artery, say in the head or the neck, and this will stop delivery of blood to a particular part of the brain, and that can subsequently die. And this is what we call a stroke. So we'll finish this topic by discussing a risk factor for cardiovascular disease, which is your LDL and HDL ratio. So what are LDL and HDL? They are monolayer vesicles, so not a bilayer like your plasma membrane, but a monolayer vesicle that carries lipids. It always seems a bit difficult to remember, which is which and what the difference is. But what you should remember is what is kind of being discussed, which is low density lipoprotein and high density lipoprotein. So the question is the density of what? And the way I choose to remember it is the density of proteins. So high density lipoprotein has a higher density of protein, less lipid, and it's small, which altogether means that it's quote unquote good. And then low density lipoprotein has a lower density of protein, more lipids, and is larger, and quote unquote bad. So if you have more LDL, you have a higher risk for cardiovascular disease. And that concludes the general biology for hematology lecture.